Now, having said all these things, it becomes very evident that at least at certain areas, a veneer will have to be attached to a dentin. That means, for example, if you have a dark tooth, and I want to design a tooth on a dark veneer, porcelain veneer on a dark tooth, and the porcelain veneer in this case will be blue, I will have to create a very defined receptacle here tucked under the gum line and go up like this and actually make it thicker than the enamel thickness. So I will talk about this area in just a moment. So up here we will probably need something between 0.8 and 1 millimeter. Let's just put in 1 millimeter for the veneer. And up here we probably need something like 0.5 millimeter. So the blue is the veneer. This is necessary because we want to have a minimum thickness. First of all, by the manufacturer, there are requirements for the particular porcelain that we are using. Number two, to block away certain stains or darknesses of a tooth without creating too opaque veneers. This also allows us to create a translucency of a veneer that gives the appearance of youth. White, opaque veneers look old. Old people have white, opaque teeth. Young people have translucent teeth. Light shines through. If you look at a 23-year-old, if you look at a 20-year-old and they smile at you, yes, they have fresh-looking teeth, they're intact, they're not broken down, they have rounded corners, there are no sharp edges, and they're translucent in certain areas. To create that youthfulness, you will have to have a minimum thickness for the veneers. Another very important thing that your dentist needs to consider is whatever he creates under the veneer has to be all rounded. You cannot have any sharp angles under the veneers because those would be stress points for fracture. That's why we don't just prepare veneers up to the edge up here in order to preserve this tooth structure. We actually wrap it around just like this, so that it lands here perpendicular to this surface, and we have about 2 millimeter here. Sounds drastic, but this is the most stable veneer design and also the most aesthetic veneer design that can be created. There are different porcelains with different requirements. There are even veneers that have very catchy names. Many patients have asked me on the internet what lumineers are. And I explained to them that lumineers, while it's a really beautiful name, really do not allow to create the youthful intricacies that I just mentioned, because they have to be very thin. And if the teeth are not prepared, they will be sticking out up here, because they have to have a minimum thickness up here if you don't prepare the teeth. So they would bulge out, they would be over contoured, and they would look opaque and unnatural. Therefore, every tooth that receives a veneer has to have, to some degree, some kind of a preparation, at least up here and possibly also up here. Now, these 2 millimeters are relative because patients may have small teeth. So if the teeth are already short and we want to have 2 millimeter here, let's say this tooth needs to be lengthened by another 2 millimeter, we don't even have to cut it down, we just go up with the veneer and lengthen it to that degree, if the function of the patient's mouth allows this, which includes chewing, biting, speech. All this has to be comfortable to the patient, and it will be tested. Any well-educated cosmetic dentist will test it with provisionals or with mock-ups in the patient's mouth.